Good evening, everyone, and welcome to a live vaccine town hall with Mayor Brian Arrigo, our Revere Board of Health Director Lauren Buck, and Dr. Nathalee Kong, Chair of the Revere Board of Health. My name is Debbie Pesca, and I will be the moderator tonight. The purpose of tonight's meeting is to answer your questions when it comes to the COVID-19 vaccination distribution process. Many residents are understandably confused, and we want to make sure everyone is up to date with what the city is doing in terms of distribution and communication efforts. To receive ongoing vaccination updates from the Board of Health, please be sure to register at www.revere.org/vaccine-sign-up. In a moment, we will hear from Lauren Buck and Dr. Kong with an opening message from Mayor Arrigo. But first, I want to provide an outline and guidelines for tonight's meeting. This is a question and answer dialogue among Dr. Kong, Lauren Buck, and the public. To minimize technical difficulty, residents participated in the meeting are invited to type their questions in the chat function on your screen or email covid19@revere.org. Please try and be concise. Questions will be reviewed and relayed to both Lauren and Dr. Kong. When several questions address similar topics, we will summarize the questions and present that to our panelists as one question. If you have questions about the meeting or are encountering technical difficulties, please indicate that in the chat section and we will try and address your issues. Now, we begin tonight's meeting with opening remarks from Mayor Brian M. Arrigo. First, Mayor Arrigo.
Thank you, Debbie, and thank you for all that you do for our seniors in the city of Revere. I know they certainly appreciate it, and I appreciate the hard work that you and your team do on behalf of our seniors. Good evening, everyone, and let me start off by thanking everyone for tuning in tonight. We had actually scheduled this town hall last week, and it comes at just the right time because we want to be sure to address some of the frustration, some of the concerns, some of the anxiety that we know many of our residents are experiencing, especially today. Starting on Monday, residents over the age of 75 will be eligible to receive a COVID-19 vaccine under the state's phase 2 distribution. We understand that many seniors are having difficulty accessing online registration platforms today, and I know that many people are really eager to be vaccinated. Tonight, we're going to cover as many questions as we can that are related to the vaccine and the distribution of the vaccine here in the city of Revere. But what I'm asking all of our residents is to please have patience. You have and you can have full confidence that the people on this call, the people in my office, the Revere Board of Health will continue to share information with you as soon as it becomes available. As you'll hear from Dr. Kong and from Lauren, more vaccination options will become available to our seniors in the coming days, and we will support our residents through this process. And I know it's a challenging, difficult process right now, but we are here to support our residents. The last thing I'll say is that this is going to get easier by the day. And we are going to be here to support our residents at every step of this process, as we have been through the entire pandemic. Today, many of you may know, some of you may not, that we launched an outreach campaign focused on reaching the 8,700 residents over the age of 65 in the city of Revere to make sure that they have the most up-to-date information on vaccination options and to help them troubleshoot through this process. And I know many of you probably had some frustrating time spent going through online portals and trying to log on and trying to get an appointment to get the vaccine. We've got several weeks of really difficult, challenging work ahead of us. But in close collaboration with the local community health providers, in close collaboration with all of the people that you see on this call and many, many more, we are going to continue to provide regular updates, and we will be here to assist our residents. Again, thank you for joining us. Thank you for sending in your questions and your concerns, and thank you for your patience. This is a really difficult, challenging time, and I understand the anxiety levels are through the roof for everyone, and that really is a difficult thing to manage. But I know that we will get through it as we have through this entire pandemic. We will get through it together. And so with that, I will turn it over to Dr. Kong. Thank you.
Thank you, Mayor. And good evening, everyone. Thanks for, as always, having me and allowing me to speak with all of your residents. I want to just, echo what the Mayor just said, that, it's a frustrating process. It's a new process. It's a huge endeavor that this country is taking to vaccinate every single person in this country who wants a vaccine. And we're not doing it just once. We're doing it twice. So it's a large endeavor, but one that, we're going to do, and we're going to be with all of you every step of the way. I think patience is key. And, we're not going to ask you to wait 5 months or 3 months or even 1 month. I think just waiting a couple more days to get the links to work better, to get the supply chain ready, to get our workforce ready to administer the vaccine. Because not only do we want to give it to you, but we want to make sure we do it safely too. So everyone who wants it will get it, and we're going to be distributing as fast and as fairly as possible. So I just want to reiterate that. A couple other points I wanted to make is, where we are in terms of the vaccine. In case you don't know already, we have 2 vaccines that have been approved by the FDA for emergency use. It is the Moderna vaccine and the Pfizer vaccine. They both require 2 shots, and they both are safe and effective at preventing you from getting severe COVID-19 infections. Both have about 95% efficacy after you get the second dose. So both vaccines are very important to have. You can't just have one, you have to have both of them. There are a couple other vaccines coming down the pipeline, a couple that are being worked on currently in phase 3. Johnson & Johnson is one of them. That's another 2 vaccine, one vaccine dose. That is a one shot vaccine. And then AstraZeneca is the other one. That's 2. 2 shots. So I'm confident that, our supply of vaccines will continue to grow as more come to market. I'm confident that the current 2 vaccines, Moderna and Pfizer, that we have, their supply chain will grow. We know there's a demand. We know how many Americans are in this country who need it. So they're all working. I'm sure they're working to create more vaccines as we speak. So we'll make sure we have enough to give to everybody. If you're one of my patients, you probably already heard my spiel. I am recommending this vaccine to all of my patients. Right now, the state of Massachusetts has just begun phase 2 for vaccinations, and that means prioritizing folks who are 75 and up to get the vaccine. But regardless, when it's your turn to get the vaccine, I'm telling all of my patients to get it. Whether you're pregnant, breastfeeding, if you have asthma, diabetes, a number of comorbid conditions, I'm telling them to get it. The only people I'm not telling to get it are those who have an allergy to something in the vaccine. So if you're worried about that, I encourage you all to speak with your providers, your PCPs, but everyone should get it. I got both of my vaccines. I got 2 of them, both of them. I got Pfizer. As far as I know, I only still have two arms, didn't grow any extra limbs or eyeballs. So still here, still kicking it. And I'm feeling great, and I'm feeling confident that we'll be able to get this vaccine into the arms of as many Revere residents as we possibly can, as fast and as fairly as we can. So just again, reiterating what the mayor said, just please have a little bit of patience with us. We want to cross our T's, dot our I's, so the process is as smooth as possible for all of you. With that, I'm going to turn it over to Lauren Buck, our fearless leader and director of public health.
Thanks, Dr. Kong. So I am going to pick up the ball and run with it here in terms of telling you where the Board of Health and where the Public Health Department and where the city is going to be able to help you along this process and the roles that we're going to fill. So I first want to talk to you about the phasing system that we as a city and a Board of Health are following. And the phasing system was put forward by the state, and it is constantly being updated. It's an evolving process. And so we encourage you to frequently check on the mass.gov website to get updates of the phasing process. But the phasing process is designed to help get the vaccine to those who need it in a safe and efficient manner, and to prevent some of the problems that can result from kind of opening it up to everyone in the state at one time. And so it's a way to try to distribute fairly safely, effectively. So a lot of our residents fall into the phase 1 category, which is where we are currently today. Phase 1 eligible people can get a vaccine. So those of our residents in Revere who for instance, like Dr. Kong, who work in a hospital setting or work in the healthcare setting and do COVID-facing care, meaning they are regularly coming into contact with people who have COVID, taking care of patients who have COVID symptoms. Most of our residents who fall into that category were able to get the vaccine through their employers. So those are the big healthcare providers that we all know of. And so those vaccines have been distributed. And actually, most people who fall into that category have actually already got their second dose, very similar to what Dr. Kong just mentioned. And the second priority in phase 1 are our congregate care residents. So these are people living in our assisted living facilities, our nursing homes, our residents who are more vulnerable to COVID simply because there's more of them in an indoor area. So that's what congregate care living is. It's a lot of people living in one area. And so those residents and examples of this are Jack Satter House and Friendly Gardens. Those residents have been working with the federal pharmacy partnership, where CVS and Walgreens are actually coming right to them to get their vaccines, and that has also started. So that is that process is well underway. So many of our residents are falling into that category, and so they are getting their vaccines already through that program. Where we as a Board of Health started with our vaccine process, and in no ways are we finished, but we started, and that was with our first responders. We have also finished our first responders' first doses for the not only Revere, but for the cities of Revere, Chelsea, and Winthrop, and we finished those last week. So like many other organizations, we are right on to the next phase 2. So the next priority of phase 1, actually the last priority of phase 1, are the other healthcare workers that we have to try to capture. So those are people who aren't necessarily falling into the bigger hospital chains or doing COVID-facing care, but there are dentist offices out there, our physical therapy offices out there, our home-based healthcare workers. So these are our VNAs, our personal care attendants. And so we are having a clinic tomorrow. We have 500 people signed up and are getting our vaccine tomorrow at Romney Marsh. So we're moving right along as a vaccine provider with the phases that are that the state has delegated. Now, that doesn't mean that everyone in phase 1 we have reached already. It means that those people are eligible, and they will continue to be eligible for when any other vaccine appointment slots become open. And so any phase that has been open doesn't get closed again. It remains open. So you will always be eligible moving forward if you weren't able to get a vaccine in any of the clinics we put on, or any of the clinics that were provided by other entities, you will be able to get a vaccine in once more clinics become available to you. You haven't missed the boat. Don't worry about that. So I know everyone is probably really wanting to hear about phase 2. And I'm reiterating everything that the mayor and Dr. Kong just said. So we were told, along with all of you, that phase 2 is open to our residents 75 and up starting on Monday. That is February 1st. Like I said, when I started talking the phases, some of the priorities, some of the groups are in phases get shifted around occasionally, and that's just kind of the way that things work now. We're all learning as we go, and the state is learning as they go. Everyone's learning as they go, so things get shifted around. And so the phase that's next up is 75 and up. Now, for this phase and for this population, our 75 and up residents out there, the Board of Health and the city is gonna be a resource to you in 2 ways. The first way is really to help you feel comfortable with all your options out there of how to get the vaccine. So we want to be a resource of information for you. We actively try to make sure we are up on all of the vaccination sites and all the different ways and different opportunities that you will be able to get a vaccine. And so we want to be able to make sure we can provide that information to you. Now, there's a lot of different ways we can do this. And one of the ways we've already tried to do this is we have a form on revere.org. Debbie mentioned this at the beginning of the town hall. This is a way you can sign up to receive continuing information. As soon as we get more information, we update that and send out email alerts or text message alerts to everyone who signed up on that Google form. The Google form doesn't mean you're signing up for an appointment. It means you're signing up to get information about what we know about where appointments are going to be coming and what phases are going to be opening. And we don't sit on information. We give it to you as quickly as we get it. And sometimes we don't get it before you all get it, but as soon as we do, we make sure that we're letting you all know. So that's one way of getting out information. Another way of getting information is we are actively putting together a large network of volunteers to reach every senior to make sure that you all feel comfortable navigating through these different channels. They are confusing, they are frustrating sometimes. Sometimes it's a lot of refreshing web pages and it doesn't seem like anything's happening out there in the internet void. Some of you also might not be super comfortable using the processes that are out there to register for appointment slots. And so that's kind of what our network of volunteers, which is actively being put together right now, will be helpful to you for. We know that there's a lot of calls and emails coming into us. We will try to do our best to answer those calls and emails as we can. That will be another way that you can access our knowledge. And then town halls like this and PSAs that we put up on Revere TV. So these will be coming out. You know, we'll be doing updates regularly as soon as we get information. And so that's kind of one way that the city and the Board of Health is going to be there to help you through this process. The other way, of course, is as a vaccine provider itself. Now, we are not going to be the only solution to getting a vaccine. We will be one of the many solutions that are coming out not as quickly as all of you probably want, but they are coming quickly. And as Dr. Kong said, everyone's getting their ducks in a row now. So we don't have situations where we have crashed websites or canceled clinics. Those are things we want to try to avoid at all costs. And that's one of the things that as a Board of Health, why we plan so much ahead of every clinic we do. So we make sure that we don't have to turn anyone away, to make sure that we have the doses and that they are effective. We don't want doses that we're giving you to be out of temperature range or anything like that. So that's why we plan so much, and maybe the process seems slow on the outset. It's all that planning that goes into it. So like I said, we are going to be one outlet as a vaccine provider for you. There will be many healthcare providers are an option. There will be more pharmacies coming online. There will be more mass vaccination sites. And although those might be a little they might not be the most conveniently located. They will be available. They will be one option. And so as a vaccine provider itself, what it looks like from the city's side is we have not hesitated one bit in terms of ordering vaccine and getting it into arms. Every opportunity we have had to order vaccine, we have done so. We have also successfully given all of our doses for every every shipment we've given, we haven't had any lost doses. We haven't had any wasted doses or anything like that. And so we are going to be a vaccine provider in that way. Our allotment will vary depending on what the state has in their hands and that they can give to us. Revere has been a very hard hit community, and the state is aware of that. Because of that, we already are able to get more vaccines than many other cities and towns surrounding us, and we have taken full advantage of that. For our 75 and plus community out there, we will have a vaccine clinic for you as a provider ourselves. We want to make sure we are completely sure of our stock before we open up that clinic. But as soon as we are sure and as soon as we are confident that we have the stock that we are thinking we will get, that process of registering you will go fairly quickly, and we'll be able to get a clinic turned around. And for all of our clinics so far, the turnaround time has been about a week. So we can turn around these vaccine clinics very quickly. We just want to, again, make sure we avoid canceled clinics or any kind of the problems that you've probably been hearing that others are having. Want to try to avoid that. And so really it's, I want to reiterate what Dr. Kong and the mayor have said. We know today has been probably a hard day for a lot of you in terms of thinking that you might have been missing out on opportunities. Where we are as a city is where many other organizations are as well, and that is getting everything in order to make sure that on February 1st, there will be an opportunity for many of our residents to get a vaccine. Now, the other thing I want to just make sure we're clear about is when 75 and over on February 1st becomes eligible, it doesn't mean that everyone 75 and over will be able to get a vaccine that very day. Unfortunately, we just know from the shipments and from the availability of a vaccine we have, it means that over the next couple of weeks, you will be able to get an appointment. It won't necessarily be that week, but there will be more and more and more options every week after that of things coming online, so it will get easier. We ask for a little patience, and trust me, I know how hard that must be to hear. I know you have all this has been a long 11 months for every single one of us, and we know it has been hard for you. And so asking to wait a little bit longer and be a little bit more patient is hard. But if we can do that, we very soon, I think there'll be a lot more options for you. And yeah, we'll be one of them.
Deb, you're muted.
You're muted, Deb.
I knew I was going to do that. Thank you, Dr. Kong and Lauren, for recognizing that it's tough. It's hard for our seniors to be patient, and thank you for asking them to be patient. I'm hoping that will happen. First question, Dr. Kong, we've received a lot of questions about allergies. If you could give us just a little bit more detail about how someone should determine if they could possibly have a reaction to this vaccine.
Yeah, so great question. The Moderna and the Pfizer vaccine are pretty similar. They both contain basically mRNA, which is how the vaccine works. The body reads mRNA. The mRNA gets quickly degraded, like within less than an hour. And then the body basically makes the spike protein, that red protein you see all over the pictures of COVID you see online. And that's what the body makes the antibodies to. And that's how it will fight the virus if it sees the actual virus coming into your body. mRNA is something we all have in our bodies, every single one of us. So you can't be allergic to it because it naturally exists in your body. Your body will never see that as a foreign object. The other main ingredient in the Moderna and the Pfizer vaccine is something called polyethylene glycol. That exists in both Moderna and Pfizer. And that's basically Miralax. It's basically Miralax. So if you've ever taken Miralax or Benefiber, that's what that is. If you've ever taken that drink to prepare for colonoscopy, that's found in that too. There is some sugars, sucrose is something that's in there, saline, so sodium chloride, that's in there. If you've ever gotten IV fluids in the emergency room, you've received saline. Sugars everywhere. I love sugar, so hopefully you're not allergic to that. If you have like a celiac or glucose intolerance, there's not going to be enough of that in there to cause any issues with your celiac or glucose intolerance. There's some cholesterols in there too, which is a naturally occurring thing in our body. So really, there's not a lot in there that could be perceived as foreign in your body, because most of it already exists in the body. And therefore, there's not a lot that you can be allergic to. What we are saying, though, and this is something actually we didn't have an opportunity to touch upon in our opening statements, but another reason why this process for vaccinating everyone is a little bit more difficult is, versus say a flu clinic is, first of all, there's 2 vaccines, but also it is important for us to make sure that everyone saves time to sit in that vaccination site for at minimum 15 minutes. We want to make sure you are monitored by our staff, by our nurses, by any healthcare provider that has EpiPens and everything you need at the ready in case an allergy happens. It's exceedingly rare, but there have been some cases of allergies to Pfizer and Moderna. I actually sent an email to Lauren earlier this week about that. CDC just reported that out of over 4 million vaccines, Moderna vaccines given, there were only 10 episodes of anaphylaxis out of over 4 million. So exceedingly rare. And they all happened within 15 minutes. So it's very important to get your appointments scheduled so that you have a time slot. You have the time to wait for at least 15 minutes. And then, and on top of that, we also want to make sure we maintain social distancing precautions. We don't want these vaccine sites to turn into super spreader events. So that's another thing that, is throwing a bit of a wrench into this process. And that's what makes it a little bit different than the flu clinics that you may all be familiar with of years past. But that's just another thing. So great allergy question. I hope I answered it correctly.
Okay. Lauren, this question is for you. Who exactly is eligible on Monday, and when are residents 65 and older eligible?
Yep, great question. So everyone who's 75 and over is eligible on Monday. Again, I want to reiterate that just because you're eligible doesn't mean that you will necessarily get an appointment slot on Monday. It means the appointment slots that are available will be open to you. 65 and over and multiple comorbidities, we do not have a date. I say a go live date, but essentially a date when the phase is open for that priority group of phase 2. It is the second priority group of phase 2 now that was kind of shuffled around. And I don't know of a specific date, but as soon as we do, we'll let you know. But as of now, Monday, 75 and over will be eligible to get an appointment size. And while we're on that topic, Dr. Kong and I also want to make sure that you feel educated after this vaccine town hall of the many different avenues that are coming online very quickly, but maybe aren't available today. I
don't want to interrupt, but this may lead into this next question. What should a 75-year-old do right now? What should they be doing? And I think that's where we're on the same thing. Explain to them what they should do.
Yes. Couple things that you could do right now. If you feel comfortable getting online, you could go to revere.org and sign up for our form. There's a yellow box on the website that says sign up here to get yourself on our kind of information, our regular information sharing registry, where we try to update you with the most recent information that we have pretty regularly. So that's one thing you could do to get more information. The other thing you can do is listening here tonight. we'll try to tell you what we know about what's going to be happening relatively quickly. And Dr. Kong can speak a little bit to this as well, but I'll kind of overview where we are. Many of the healthcare systems, many of the healthcare providers in our area are making plans as we speak to have the ability to vaccinate their patients. So if you have a relationship with a doctor or primary care provider, I don't want you to feel like you should have heard something from them already. It means that there is a possibility that you will be offered a vaccine through that means. So your primary care provider or your primary care provider's healthcare system. When I talk about healthcare systems, I'm talking about MGH or Beth Israel or Cambridge Health Alliance. So like the systems that your primary care provider works within are making plans as we speak, or East Boston Neighborhood Health Center is another example. Though they are making plans to vaccinate their patients, and some are making plans to help vaccinate even people who aren't their patients. But that is on an organization by organization basis. And so that's going to be one option. So if you're looking to that option, here's what you can do right now. Make sure you feel comfortable using the patient portal system that's designed for each of your primary care providers. If you don't feel comfortable with that system, that's okay too. So one of the ways you can make sure you still know what's going on is to call us, and we can try to help you with that process, and we can try to help you navigate on our information systems. But also many of these healthcare systems are setting up call centers and a phone number that you'd be able to call. So if computers aren't necessarily your thing, look out for phone numbers to be coming to you. And once we get the phone numbers, we will provide them to you as well as places phone numbers to call to see if your primary care provider or their healthcare institutions that they work under are going to be an option for you. So that's something you can do. Another thing you could do, again, if you feel tech savvy or computer savvy, is get familiar with some of the websites that are out there that do provide appointment slots. One of them is called maimmunizations.org. This is one that you could get familiar with. I'm not saying that you can get an appointment slot right now, but maybe get familiar with it, see what it looks like, and familiarize yourself with the buttons that you'd have to click to get through there. Maybe you could also go to the CVS or Walgreens website. Again, I'm not telling you that they have vaccine slots right now. I'm telling you that these are going to be options for you in the future. And their appointment slots will be coming online soon, not necessarily tonight or tomorrow night or Saturday night, but soon. And so maybe familiarize yourself with those websites. Now, if everything I just said to you is kind of overwhelming, that's okay too. You're not out in the dark. The best thing I'd say for you then is to regularly update yourself with watching the updates we give through these types of systems, through the PSAs that we put out on Revere TV, through these town halls. And then also, you can utilize the senior center as a resource to call into. We won't always have the answers, but we'll try to get them for you, and we'll try to do our best to help you navigate that. And then the other thing I'd say is, what could you do right now? I'm going to say, try not to panic. And I know that's a really hard thing to ask, but you're not missing out. You will get a vaccine. It might not be on February 1st, but we will get you a vaccine. So try to take a deep breath. We're working as hard as we can. We are, and we know that you're anxiously awaiting this. But in the meantime, take a couple deep breaths and recognize that it will be there for you. A little bit of patience, and that's kind of what I'd say for what to do right now.
Thank you, Lauren. And just to add to that, you can always call, like she said, the senior center, and also 311. Mm-hmm. We are there to help. They are there to help as well. And if you aren't tech savvy, also your sons, your daughters, your grandchildren, ask for help. Yes. Don't be afraid to ask for help.
Debbie, if I could add one thing to that.
Go ahead. Absolutely.
In addition to getting in touch with 311, if you do feel comfortable, logging into the internet or using your computer, many health centers have patient portals. And so I would, at least at MGH, we are encouraging as many patients as we can to get on the portal if they're comfortable getting on the portal, because that's another great way to get updates from your doctor, your primary care provider, and from whatever health system you belong to, whether it's MGH or Cambridge Health Alliance or East Boston or BI Leahy. So that's another thing that you can do right this minute, just to make sure you're getting the most up-to-date information as quickly as possible. And then the other thing too is don't forget what, as the mayor said, we have our campaign to reach every senior. So we're going to try and do the work for you. Right. We're going to sit back and we're going to try to reach out to you and to make sure that we have your correct contact information, and to make sure we're able to help you, get up to date. Get on these online platforms if you want to. And when it's time for us to start giving the vaccines, we're going to make sure you all get booked. So, we just need a little bit of time, a little bit more of your patience, and we'll have this ready to go. Once we get over this hump, it's going to be smooth sailing. I know it.
Okay. The next question is from a resident, and she says, I am pregnant. I had planned on getting the vaccine as soon as it was available, but I just saw an article that said pregnant women should not get the Moderna vaccine. Can Dr. Kong address this?
Yeah, so I think it is totally safe for you to get either vaccine. Alrighty, thank you, Ruben. The American College of Gynecology, in addition, MGH has released statements on, whether or not this vaccine is safe, and it is. ACOG, you'll see it was last updated today. There's a big preamble on this website, talking about vaccine safety, but in the middle of the document, they do recommend that women who are pregnant or who are breastfeeding should get the vaccine. The main reason for this is because women who are pregnant, when they get the vaccine, if they get coronavirus, they have a high risk of suffering from some complications of the coronavirus because they're pregnant. So the best thing we can do is to offer them a vaccine that will give them a 95% immunization, 95% protection from getting the coronavirus, and thus from suffering from any sort of, complications of COVID. All right. Same goes for breastfeeding moms. As I mentioned before, both Pfizer and Moderna, these are mRNA vaccines. The mRNA will not get into the breast milk, and if it does, it's at tiny, tiny proportions. As I mentioned before, the mRNA, it already exists in your body, and the one we're giving you degrades pretty quickly. In under an hour, we can no longer detect it in your deltoid, in your muscle that we give it in. Can't detect it after about 40 minutes. Both are safe because both are very similar. That MGH website that Ruben put up a minute ago, anyone can access it, MGH or not. We can post that website for any, if anyone has some questions and wants to kind of click around. But within that website, you'll see a list of all the ingredients of both. And when you compare it, they're both very similar. They're both almost exactly the same. So both are totally fine. Just from a personal story, my very best friend, I was supposed to be the bridesmaid, the maid of honor at her wedding, but that didn't happen, but because of COVID. But she's pregnant. She's in her second trimester, and she just got her first dose of the Moderna vaccine. She's a pediatrician in Michigan, so she's COVID facing. So she just got it. So she's really, really happy and excited about that.
Thank you, Dr. Khan. Next question, Lauren, can you review the additional priority areas within phase 2 and clarify if we know when these groups will be reached? We have a lot of questions from our teachers and our essential workers regarding when they will be vaccinated.
Yep. And if we could put the graphic of the phases up, that would be great as I talk through it. So, like I said, the phases the phase 2 priority groups were shuffled around a little bit over the last couple of days. We know we have a go live date of February 1st for 75 plus. We do not have a go live date for any of the other priority groups in phase 2. That's probably not what you wanted to hear out there who asked the question, but it's what we know right now. But let's just kind of talk through them. So the next priority phase is phase 2 priority 2, which is individuals 65 and over, and those with two or more comorbidities, which I'll talk about in just a little bit. The third priority of phase 2 is what I like to call the essential workers category. There's a lot of people in that group. Teachers are in there, early educators and daycares are in there, grocery store workers who've been working in every day, going into the grocery stores and making, those are, man, essential workers. There's not many more like them. Grocery store workers, utility, food and agriculture, sanitation, public works, other public health workers. So it's a big priority group of phase 2, and we don't have a go live date for them either. And then finally, rounding out phase 2 is the individuals with one comorbidity. So we don't have a date when any of the rest of the priority groups will be able to be eligible. I think there's many reasons for that. One of the reasons is because at this point we are managing not just our state, but the country as a whole is managing a stock of vaccine that is it varies depending on how much we know we're going to get regularly. And so we don't want to open a phase and not have any vaccine to give that phase. And so that's something that is actively being managed and worked on. And in terms of, as Dr. Kong mentioned, there are other vaccines coming soon, and they might give us even more availability of vaccine. And so we might be able to speed up some of the priority phases if there are more vaccines even on the market and we're able to use. So that will play a factor in when the phases come online. And so at this point, the state has been able to kind of continue with the initial timeline that they thought. And if you remember on the graphic, phase 1 was I think it's like a December to February, phase 2 February to April. We're right in that range. We haven't fallen off. There you go, December to February, phase 2 February to April. So we're right on track there. So anywhere from February to April is when they initially were planning that any of these phases would be opened up. And so we haven't been delayed in any of the phases so far. And so potentially that's still the time frame that we're going with. It's a big range. Obviously, that's a couple months. But right now, that's all I can tell you about when those other priorities of phase 2 will be open. The last thing I just want to say is I mentioned individuals with 2 or more comorbidities. Comorbidities is just a fancy word for chronic medical conditions. And if you feel like you might fall into that category, this is really where you're going to have to rely on your primary care providers who know your health history the best. And will be able to, give you the vaccine in their setting, but we will also be able to provide vaccines to that priority group as well. If you're wondering what constitutes a comorbidity or a chronic medical illness, there is a link on the mass.gov website that kind of outlines what those conditions are.
Okay. Lauren, the next question will be, will there be resources for homebound seniors?
Great question. Very, very good question. I'm glad we are talking about this because it's not something that we've mentioned before. Yes, there will be. We as a Board of Health will be one of those options. So exactly what Dr. Kong mentioned, this vaccine isn't quite as easy as the flu vaccine in many different ways. It doesn't come in individually packaged doses. There's very strict temperature guidelines we have to follow. And because of all that trickiness, it makes the the planning process of getting individual doses of vaccine to houses a little bit more, requires a little bit more planning, but it's something that as a Board of Health, we recognize is going to be a big need, and it's something that we can potentially fill with the doses that we are allotted. So that will be something that we will, provide. It's another reason why on the Revere.org form, there is a question that asks, are you able to get out of your house to get the vaccine? If you're not, it's good for us to know that. It's good for us to know how many people are out there that we would have to be reaching. Again, we're going to be one component of that, but there are going to be other organizations who are targeting their homebound populations as well. The big healthcare systems are thinking about this, so they are going to be an option for you as well. We will be an option for you as well. You will not get left behind. We will come to your homes. I'll do it. I myself will come to your home if I need to. We did it for our flu shots. We'll do it again for these. We will be wearing PPE just like we did for the flu shots. So we'll be gowned up, and we'll give you the vaccine. We'll obviously be monitoring for you for the allotted amount of time. And so you can imagine, if we're doing individual shots in people's homes, the process will take longer than doing a kind of a site where people rotate through. But yes, we are thinking about you, and it's one of the reasons why we have incorporated into our Revere.org form if you think you're able to leave your house to get the vaccine or not, because it will help us plan and order appropriately when that process is kind of in place. But yes, you'll have an option. You'll have an option from many different providers.
Lauren, I have another one for you. And Dr. Kong, I promise we're coming back to you. Lauren, can you tell us why the city can't just get more doses and administer the vaccine ourselves? Yes,
I can tell you why. And there's many different reasons behind why. As a city, the state has recognized that we have been disproportionately impacted by COVID, and what that means is we've been a really hard-hit community. Because of that, because of that, we are able to order more doses than other cities. And I mentioned this before in kind of the opening statements that we talked about. We're able to order more than many other surrounding communities already. The amount that we are able to order as a Board of Health, unfortunately, is not enough to cover our entire population. So as a Board of Health, right now in this exact moment and for the next couple of weeks in the future, we are only able to order from the state 400 doses a week. And we do order 400 doses every time that we're able to. And if we were able to order more from the state, we would do so. But the reason the state has put a kind of a cap on how much each local Board of Health is able to order is many different reasons, but one of them is they have to try to manage their own supply and frankly, there's not enough vaccine to go around right now. We can't, just because of the fact that there's only 2 available to us, and for many other different reasons, but there's more of a demand than a supply right now. So I wish we could order 10,000 and give them all out, but we are only able to order 400 a week right now. Again, everything can change in a second. Right now, we are able to order 400. We do every time we're able to, and then like I said, our usual turnaround time for clinics is about a week. So once we know we have the doses, we can usually turn around a clinic in a week. But we aren't able to order more than that for many different reasons that unfortunately have go beyond the state of Massachusetts, and what we're the kind of the constraints we're living in right now. And that's, again, maybe not the answer that anyone wants to hear. It's not the answer we want to have. We want to be able to order more, but we order as many as we can.
Thank you for an honest answer, Lauren. Sorry to put you on the spot.
I could add something, Debbie.
Dr. Kong, I have heard if you had COVID, you should not get vaccinated within 3 months of infection. Is that what the recommendation still is?
That is a great question. One of my favorites, actually. But just to add on to something that Lauren said, think of the supply chain of vaccines right now similar to how PPE was like in the beginning of the virus. Remember, no one could find all the PPE that they needed, and a lot of hospitals were using garbage bags. My God, it just like pains me to even say that. But a lot of hospitals were using that instead of the gowns. And now we're replete with PPE. We can't get enough of the PPE in any of our hospitals, which is great. But, again, once we get over this hump, it's going to be smooth sailing. And I think we just need to kind of get over this, get past this huge demand right now, get a critical mass of folks vaccinated, a critical mass of vaccines out there, and then it's going to be much better. So just a little bit of patience is the theme of the night. Back to your original question, Deb. If you've had the coronavirus vaccine, a lot of folks are recommending to wait 3 months to get the vaccine, simply because we are understanding, as we're learning more and more about the virus, is that you will have protective antibodies for about 3 months or 90 days, just about. So you don't have to get it immediately, but you can get it. It doesn't mean that something bad will happen to you if you get it. You will not suffer an unusual side effect. The vaccine won't have a more severe reaction in you than anyone else. You'll get the same sore arm, maybe a little bit of fatigue, maybe some headaches, just like everyone else. Because the vaccine is giving you what you already have. It's giving you antibodies. The one difference between the vaccine antibodies and the antibodies you created after an infection is that the vaccine will last longer. The antibodies you get from the vaccine will go on to cover you for more than 3 months. We're hoping at least a year. Studies are ongoing about that. So, again, we're learning every day as we go, and we'll obviously know very soon if the coronavirus vaccine is going to look a lot like the flu vaccine. We'll see if it looks like something you get every single year. But for those who have had the coronavirus infection, I do encourage you to get the vaccine because the protection will last longer. Those who have been recently infected, as long as you no longer have any severe symptoms like a fever, like shortness of breath or chest pain or anything like that, and as long as it's been at least 14 days since your positive test, you can get the vaccine. You can get the vaccine. It's okay to get the vaccine. So as long as you kind of fit those criteria, you can get it. You're eligible to get it. And I don't think anything bad's going to happen to you. And I would encourage you to get it if you can. For those who are still recovering, we ask that you wait until you're fully recovered from COVID. You may have a little bit of a lingering cough. As long as you don't have severe symptoms, you're good to go. Alrighty.
Dr. Khan, just as a follow-up on that, is the vaccine effective against the new variants of the virus that have emerged from the UK and South Africa?
As far as I know, it is going to be effective. This virus is still the virus itself, though there is a variant, the spike protein remains the same throughout, and that is what these vaccines are focusing on. And once this vaccine is in your body, your antibodies will be targeting that spike protein. And so as far as I can tell from the doctors and the ID specialists I've spoken to, that has not changed within the variants we're finding to date. I hope it doesn't change. I obviously can't see into the future, but my senses from speaking to a lot of infectious disease professionals is that we're going to be okay through these variants. One other thing I would like to add is that though you've received the vaccine already, I urge you to continue to wear a mask. I'm still wearing a mask at work, even though I have the vaccine, and most of my colleagues have been vaccinated. I'm still wearing a mask at the grocery store, and that is because even though this doesn't cause severe COVID infections, we're still doing research to make sure it doesn't cause asymptomatic infections. And if your entire household has not been vaccinated, who knows, you might bring it home to them. So I still want to urge people to be cautious. We're not done with masks yet. Don't throw away your masks after you get the vaccine. Keep them, take care of them, wash them. And just another small caveat I want to add is that the reason variants exist is because people are kind of passing around this virus to each other. That's how the flu virus changes every year, and that's why we have to give a new flu vaccine to everyone every single winter. So again, the best way to not allow this virus to get smarter and to change on us is to not pass it around and not continue spreading it. And the best way of doing that is to stay at home, social distance, wear your mask. So I think that's something that I think is kind of dawning upon a lot of us right now. So hot off the press, at least hot off my brain, is that tidbit. So I urge you to just continue to exercise caution and just do what you've been doing for the last 11 months, even after you receive the vaccine.
And how long? So even after you get the vaccine, you continue, but how long do you see that? For another year?
I think that's a really good question. I think that depends on how fast we can get the vaccine out. And as Lauren just mentioned, there are a lot of different variables all at play all at the same time regarding, how our supply gets replenished, how we're safely standing up these vaccine sites so that we're giving it quickly, but also safely. Remember, 15 minutes in that chair with us. And even if you're home, we're going to have to figure out a way to do that too when we do homebound shots. So there's just a lot of different nuances we want to make sure we get right, because your health is in our hands and we want to take it seriously. We do take it seriously. So when we get to kind of go back to normal and go back to, when we get to throw our masks away, I'm not sure. I think it depends on when we can achieve herd immunity and when we have achieved a level of community infection that is really low enough to make us confident that we don't need to go out with masks, that we can, go back to the movie theaters, we can go back to the bowling alleys, we can do all these things. So I'm hopeful for sometime this year. I just don't know exactly when, because everything is a moving target right now.
Thank you. Lauren, why can't the condo buildings on the beach have vaccination clinics like the Jack Satter did?
Okay, so that's a good question, and I think it comes back to the fact that some of our congregate care buildings fell into the categories that the state gave that made them eligible for phase 1, and some of our other buildings didn't fall into that category. So it comes down to kind of the distinctions that were made by the state in order to determine who classified for to fall into that phase 1 priority 2 category. I can tell you that as a Board of Health, we are thinking about the best way to utilize the doses we are given and make sure that we reach buildings that need it and that potentially weren't reached in other ways. So the answer, it's a hard question to answer, because it has to do with if you were designated a certain type of building, but it doesn't mean that we don't know about you and don't recognize that we need to make sure that you are you feel comfortable with the ways to get a vaccine to the people who live in your building, and recognizing that a lot of you probably are going to start to become eligible pretty soon. Meaning Monday. And so there will be options for you outside of your building, but we recognize that an option coming to a building is potentially needed. And, we're thinking about it, we're working on it. And yeah, we recognize that there are a lot of buildings out there who didn't necessarily fall into the categories that we're already started on.
Lauren and Dr. Kong, we have about 2 minutes left. I'm going to ask each of you to give just closing remark, if you would. Lauren?
Sure. Yeah. Thanks for tuning in and listening. I know we definitely haven't answered all the questions out there. We could be on here all night with all the questions that are probably out there, and we know that. And so communications from us are going to continue in the many different ways that we mentioned before. There's going to be more communications where Deb and I come on and talk to you a little bit more. We will do those when we have more information. I say this a lot when I talk about COVID and when I talk about the vaccines. It's been a long, hard 11 months, and all of you out there, we know. I feel it every day. It's what keeps me up at night, and we know. I feel the desperation from many of you to get this vaccine. I feel it. Please don't ever think that I don't. It's one of the only things I think about every day. And so, like I said, we will do our part to help in those two capacities, to help get you the information, to help you feel comfortable with where to go, and also as a vaccine provider ourselves as one of the many options. And we'll continue working at it.
Dr. Kong?
To reiterate what Lauren said, thank you for tuning in. Thank you in advance for your patience. I know we're asking you to do a lot. It's been a long, hard year. I recognize everything that's been lost. The lives that have been lost are obviously something that's just immeasurable and calculable. But I know that there are a lot of folks out there who have been isolated for a long time. There have been a lot of missed birthdays, missed holidays, canceled weddings, canceled graduations and proms. I want us all to be able to get back in the classroom, get back on the beach, and do all these things. And I promise you, we're going to do everything we can to get us there. We're all on the same team, all of us and all of you. We all want the vaccine. We all want the same thing. We're going to do everything we can to make sure that it is delivered to you quickly, fairly, equitably, and with as little headaches on your part as possible. So just little bit more patience, and I promise you we'll deliver on everything we're saying.
I want to thank Lauren, Director of Public Health, and thank you, Dr. Kong. I have the pleasure of working with these two amazing, hardworking, brilliant women every day, and I hope our city recognizes how fabulous they are. I hope you enjoyed our town hall this evening. Thank you, Mayor Arrigo, for joining us, and thank you for being with us tonight.